Welcome back. In today's video, we are going to discuss about counseling, the elements of counseling, the gather approach and cafeteria choice, followed by the Delphi method of communication, and lastly, the spikes technique of communication. Along with this, we'll be dealing about all the MCQ questions which have appeared in the previous topics and today's topic in communication. Let us start with counseling. We have already dealt this slide in the previous video. Let us brush it up and understand the elements. Counseling is a face to face communication to help a person in decision making or solving a problem. Here we are concerned more about the health education, right? We are dealing about communication for health education. So we see that you are helping the person in making a decision or solving his problem. Counseling will help to motivate and change the behavior of that person. It is different from advice. Counseling gives a choice to the clients, whereas advice doesn't give any choice. Advice is direct without any choice, whereas counseling gives a choice. If you want to do it, if you want to do it, you do it. If you don't want to do it, you don't. So it gives a choice to the client. Counselor. Now we are talking about this person, the counselor. He should have sympathy, understanding, and patience. The counselor must have sympathy, understanding, and patience is very important. Patiently, he has to listen to the person, his emotions, he have to understand them and have sympathy towards it. Counselor should be able to gain the trust of the people. Like we said, he should gain the trust that the information or the things he's getting from the client will be kept very confidential. He should have sympathy during listening. He should understand the person's feelings. Also, he should help them to resolve the problem. This is what we have already dealt about this slide. Now we brushed it up. Now let us start the elements of counseling. Elements of counseling and also the gather approach and cafeteria choice. Okay, two things we're going to deal: gather approach and cafeteria choice. Let us begin with elements of counseling under that gather approach. In gather approach, we have a synonym GA. Okay, see, we have GATHER. Gather approach, a mnemonic gather. Using the word gather itself, we can remember all the points of it. G for greet the client, whoever the client is. Once he enters your clinic, greet the client. Ask the problem, you need to inquire about their problem. G, done. Gather, right? So G, greet. A, ask the problem. For T, telling different methods to solve the problem. Now you are proposing the different methods to solve their problem. Also, H stands for helping the client to make a voluntary decision. So we see that you are proposing different ideas and different solutions. Also help the client to make a decision to choose one of your solution. Help the client to make a voluntary decision. Explain. E now. ER is left, right? So E stands for explain fully chosen method. Now they chose a solution or chose a method. That method should be fully explained to the client. R stands for you should ask the clients to return for the follow-up visit. Currently, this gather approach is used in contraceptive counseling. Gather approach has been replaced by the term cafeteria approach or a choice. So, in the chapter demography and family planning, we have already studied about the cafeteria choice. Let us understand in depth today in communication for health education. So, we see that in cafeteria choice, when you think about the contraceptive counseling, what we had studied here, the doctor has to greet the client. She has to ask the problem. Have they come for spacing the child, or do they want to space the child for a period of 10 years or 5 years, or are they newly married, and or is it like their family size is completed and they have come for sterilization. The need of that client has to be asked, and now you propose the different methods. Now if they have come for space the child, you can ask them to take barrier methods and hormonal contraceptives. So you're proposing the different methods, copy different method to solve the problem. Now the woman is confused. She tells that, oh, I forget a lot, I don't think so I can be able to take pills every day. Okay, if she's all confused, then you can tell her, okay, you can go for copy. You don't have to, just one time motivation is required, and then daily she don't have to have that headache of eating pills every day before getting out of the bed. So you should help the client to make the voluntary decisions, and then after she makes the decision, explain fully the chosen method. You have to explain her about the copy, how it will be inserted, and then how long is the hospital stay, what is the cost of the copy. So all of that you have to explain her fully. Then once the insertion everything is done, once she agrees to it, you should ask her to come for the follow up. So this was about the gather approach. Okay, gather approach. Now it is replaced by cafeteria choice. Okay, cafeteria choice. Let us see. In the cafeteria choice, we have the basket of choice for contraception is provided to the couples under the reproductive and child health care program. Okay, so we see that you provide the contraceptives, various contraceptives, five official methods of female sterilization, male sterilization, intrauterine contraceptive devices, OCPs, condoms. All of these are provided to the couples, and they get a choice to make a basket. Okay, a basket with all of these contraceptives, a basket with all of these contraceptives present in it will be provided to the couple, and they get to choose the method. It's a cafeteria, like how we provide the menu, right? Similarly, this basket will be provided to them and they will get to choose. Next, let us begin with the Delphi method of communication. Delphi method is a systematic and interactive forecasting method which relies on the panel of experts. To understand Delphi method, let us take the time of Corona. So what happened, guys? A panel of experts were taken, okay? Experts from all over. A panel of experts, let us, fine. A panel of experts were considered, and then the interactive forecasting method, and it is very systematic. It has certain rounds, it has questionnaires. So we see that it is very systematic and interactive. Everybody interacts with each other in this method, Delphi method, and the forecasting method will be based on this panel of experts. Based on the principle, so this Delphi method is based on the principle that forecast from a structured group of individuals is comparatively more accurate than the unstructured groups. So forecasting is what, guys? Forecasting is perceiving what is going to happen. Okay, perceiving what is going to happen. So they forecast which is taken from the structured group of individuals is comparatively more accurate rather than the unstructured groups. Delphi method involves the formation of team to undertake the Delphi method on given subject. First, they form a team. What do? They form team. Okay, they form teams to undertake the questionnaires or the information formation of team, so that this Delphi method is practiced on a given subject. Now our subject is Corona, so we form the teams. It involves the selection of one or more panel of experts to participate in this exercise. Also, Delphi method selects the panel of experts to participate in this exercise. Experts are selected so that they can participate in this session. Delphi method is a tool for increasing the consensus among the large population. So we see that out of all this large population, one representative we got. Out of this area of population, one representative. The entire community's perception will be given by him, and the other community people by him. So we agree, consensus is what? Agreeing on one thing. Okay, large population agreeing to one thing. It To agree to one thing, this Delphi method plays a very important role, where increasing consensus among the large population, we concise all of it and come to one decision. In Delphi method, the various population representing them, we have panel of experts. There will be systematic interaction going on in between them. There will be certain rounds and everything which we'll discuss in upcoming slide, and later they will agree to one thing. They agree to one thing. The large population will be agreeing to one thing. Okay, let us see. Okay. Okay, there's a slide missing. Fine. So what happens, guys, in Delphi method? There will be multiple rounds. Okay. In each of the round, the questionnaires will be given to the panel of experts. And now, let us consider five people are there. Okay, one, two, three, four, five. Five expertise are sitting here. Now, the first questionnaire, they will give all of their reviews. Then in the second questionnaire, again they will be asked to reconsider their views and also consider the other people's views. One person speaks and all of them listen. Similarly, everybody gets a chance to speak, and everyone gets to know the reviews of all the other experts. Once all the reviews are known, then again they will agree. Now one will agree that what the second said is right. Second will agree that okay, what I'm saying is right. Third will agree second person is right. Fourth will say no, I am right. Fifth will say no, I am right. Then in the next round, again the questionnaires will be provided, and again they will reconsider their views. And finally, everybody agrees on that thing that what the second expert, their treatment is correct. So finally, this questionnaires will be given, and the experts will come to a common conclusion that the treatment which was given by the second team is accurate. So all of this, the second team, the third team, fourth team, fifth team, all the five teams will agree on one decision that second treatment, the team B's treatment is accurate. It is by a systematic questionnaires, systematic rounds. Questionnaires will be provided. For example, now corona time, a questionnaire: does like lockdown affect the mental health? How will the lockdown affect the GDP of the country? All of these reviews: is lockdown necessary? What will be the effect of lockdown on the school? Such questionnaires will be provided, their reviews will be given, and then what could be the method of treatment? That could be one of the questionnaire. And the other questionnaire, they might discuss about the the treatment regarding the vaccine. So everybody came to a conclusion that others said symptomatic treatment has to be done. So similarly, the other proposed many other things, and one of them proposed vaccine. So a panel of experts, they will review their decisions and come to a conclusion, consensus, and that will become the concluded result of this Delphi method, which will be imposed on the large population. Okay, guys, I hope the Delphi method is clear. And now we move to the spikes technique for communication. In the spikes technique of communication, we are breaking the bad news to the people. So spikes approach is used for communication with patients or attendants for breaking a bad news. Here we use this method for breaking a bad news. Example: communication of cancer prognosis or the adverse outcomes of cancer. For the spikes method, let us consider cancer. Guys, the spikes method, again, S stands for setting up an interview. P for assessing the perception of that patient or an attender. I stands for the invitation to explain. K for imparting the knowledge, E for addressing the emotions, S for summary and strategy. So let us discuss each of this in detail. S, setting up an interview. Spikes, right? Setting up an interview. Spikes. S for what, guys? Spikes. S for setting up an interview. The interview, you should choose a private room, comfortable, non-threatening environment has to be there. They shouldn't be threatened about somebody else listening to what the doctor is explaining to them. So it has to be very confidential. It has to be very private and comfortable. There must not be a very threatening environment. No threatening environment. That is how the interviews should be set up. Then assessing the perception in the sense uncovering what patient and family think is happening. So understanding how much do they know about it. Now you're breaking about cancer. How much do they know about cancer? Then you need to know what is the level of understanding of the patient and the family regarding that disease. Once you understand it, you have to give an invitation to explain. Ask the patient what they would like to know. Ask the patient might have a question like, am I going to lose my organ? Am I going to die in 6 months? So what will be the effect of it? They might have lots of questionnaires with them. So you have to ask the patient what they would like to know, and then impart the right knowledge to them. Explain the disease and also the care options in the plain language. When you're speaking about cancer, don't tell them there is proliferation happening inside and that can invade into the adjacent organs and the malignancy can spread. No, you cannot use such medical language and explain. Instead, tell them in a very plain language. Try to use their mother language. Convert it in a very simple and easily understandable way. Addressing the emotions, then just telling them, okay, you've got cancer, you're gonna die in 2 months, fine, bye. No, this is not the way. You need to understand their emotions, respect their feelings, what they're going through, understand, sympathize towards them, respond with empathy, okay? And then that is how you're going to address the emotions. And finally, the summary and strategy. Now the cancer, the stage of the cancer, how can we, what are the treatment options, if there is cervical cancer, what type of surgery has to be done, all such things, okay? You have to explain the strategy to them, recap and decide what's gonna happen next, what is the treatment options, what care can be taken, and give them the summary. This is about the spikes approach. I hope it's clear, guys. Let us summarize. S stands for setting up an interview, P for assessing the perception, I, invitation to explain, K, imparting knowledge, E, addressing the emotions, S stands for summary and strategy. I hope it's clear. With this, we come to an end of the video. We will also discuss about the MCQ questions. We'll make a short video. In the next video, we'll deal about all the MCQ questions so far which have appeared in the NEET exams. Thank you.